Today our speaker is Deborah Ivy, and I said, Deborah, tell me more about your background. I know a little bit, and I know we're fortunate to have her at Coosa Valley. And she said, well, I'm going to tell you, I started a long time ago, and I'm very, very young. And I get that, because that's how I feel. So Deborah has been in healthcare for over, well, right at 40 years. I don't want to stretch that, Deborah, and say over. Okay. We'll just stop at 40 years. And she has a degree from Birmingham Southern, one of our well-known, well-loved campuses here in Alabama. And it's in business and finance. But she has spent her career knowing about health care and how that works from an insurance purposes, from finance, from business. And I know she probably feels the way I do, that that's come a long way. It's very different. There's a lot more choices. And may I say, it can be very confusing. So today, we decided to ask Deborah to come and share her knowledge and help us understand more about the choices that we have and what works for us. So will you help me welcome Deborah Ivy, and let's talk about healthcare and insurance and all the options.
Well, good afternoon. Can everyone hear me okay? Great. Well, we appreciate you coming out today and hope you enjoyed your meal. It's really great that we're having this because I'm hoping I can share information with you that would make you have a more informed decision about your Medicare choices. We're hearing so much out there on the news. Every time you turn on the television, there's a commercial with an athlete or a famous person going, hey, you need to get this insurance plan. You get this free with it. So there's a lot of information out there. We're going to try to dissect that a little bit. Now, I'm going to make a disclaimer. I am not an effective speaker. I'm not eloquent and polished, but I am, however, very fluent in two very uncommon languages. One, Blount County country girl. Two, Medicare speak. And you never know when I'm going to break out into that mid-sentence, so y'all stop me if I do that. But really, this is a serious topic, and I want you to have information that will help you. There we go. Whoops, I went back too many. Okay, I'm going to start off I call it the Medicare alphabet soup. Originally, when Medicare came out, we had Parts A and B. And let's just make sure we all understand what Medicare Part A covers. That is the part of your Medicare benefit that covers your inpatient hospitalizations. It covers home health. And if you need a skilled nursing facility visit, it pays up to 100 days of skilled nursing. For example, if you should need a major joint replacement, need rehab afterwards, you would go to that skilled nursing stay. Also, Part A covers hospice, even though that's normally carried out by an agency. We also have Medicare Part B, and that's what covers your outpatient hospital visits, like when you come into the ER, you get a CAT scan, X-ray, outpatient surgery. It covers your visits at the physician office, any ambulance services, or durable medical equipment. Well, about 30 years ago, Medicare decided, there's all these health maintenance organizations, or HMOs, out there that deliver health care differently. So they opened up for certain plans to participate, and instead of having your Medicare benefits administered by original or traditional Medicare, you can sign up and join a Medicare Advantage plan. There's a lot of them out there on the market right now. Now, you still have Medicare, but if you elect to go with a Medicare Advantage, all of your claims, authorizations, anything you need related to your Medicare coverage would be administered by that Medicare Advantage plan. Now, Part D came along because prescription drug costs, right? They're so expensive, the things you go pick up at your local pharmacy. Parts A and B Medicare do not cover that, so you need something to take care of your prescription drugs. So that's another plan we'll talk about today. Because there is so much information out there from so many sources, about how Medicare Advantage works and which plan's better. I feel like a lot of them are going to be biased. I went straight to the original source, which is Medicare.gov. And Medicare.gov has a list of 7 things that you really need to think about and evaluate when you're making your choices. And we'll go into each one individually. The first being cost, then the coverage that it offers, any other insurance you may already have, any prescription drug coverage that you may need, your choice of doctors and hospitals, your quality of care, and then the last thing is travel. So let's take a little look at each one of these. Okay, let's talk about cost. That's a big deal, right? You're interested in what you're going to be spending out of your pocket each year. And my first suggestion is to take the past 12 months and think about how much have you spent for your Part B premiums, for any supplemental insurance you may have, for any drug coverage you have. So how much do you spend this past 12 months in hospital deductibles or co-payments, doctor's office visits? Do you have an out-of-pocket expense maximum with the coverage that you currently have? Now, with original Medicare, you do not have a limit on your out-of-pocket expense unless you have a secondary insurance. Then that secondary insurance should pick up the co-insurance and deductibles that Medicare applies to your claims. All right? Now, with a Medicare Advantage plan, most of those do have a cap, a maximum out-of-pocket for the year. So those are things to consider. And I'm going to give you a little example of original Medicare. Okay, we talk about Part A. That's what pays your inpatient stays. There is no premium for Part A. You don't pay anything to have Part A services. We haven't seen the 2024 deductible amounts published yet, but for this current year, the inpatient Part A deductible is $1,600. That is due for every inpatient admission, unless you get readmitted within 60 days. Now, if you have a supplement insurance, it should pick up and pay that $1,600. But if you have Medicare and nothing else, you would be looking at a responsibility of $1,600. Now, if you should have an extended hospitalization stay, which we all hope you don't, but Medicare looks at what's called a spell of illness. And if you do that, you would be having a stay where you're in the hospital or in and out of the hospital more than 60 days within a spell of illness. Then we go into what is called coinsurance and lifetime reserve days. And those have daily co-payments for each day. Again, the supplement would pick up and pay those balances. Now on Part B, which is your outpatient hospital physicians, you do have a monthly premium, unless you have Medicaid entitlement or something of that nature. That Part B premium varies depending on when you enrolled for that Part B. So, for example, if you came eligible and you did not take Part B when you were originally eligible, sometimes there's a penalty applied. But the average premium right now is $165 per month. That normally comes out of your Social Security check. So it's a bill you're paying, but you're not getting a bill. Okay, the Part B deductible for 2023 is $226. That is an annual deductible. Once you meet that for the year, you're finished. It's met, unlike the inpatient deductible. There's also a 20% coinsurance of the Medicare allowable rate. Now, not charges, but allowable. So, for example, if you had a charge of $100 and the Medicare allowable is $50, then you would owe 20% of $50, not $100. Does any of this make sense, or am I speaking another language up here? Okay. When you've been doing this so long, you take a little bit of it for granted. But like Vanessa said, I was really, really young when I started. took an account that was on my desk and just used this as an example. Now, each Medicare Advantage plan that's out there offers different plans. Let's say you picked Blue Advantage. They have different plans. The lower the premiums, the higher the co-payments. That's how that will work. If you want a plan where you do not pay as much of a copay on each visit, you would have a higher premium. That's where you have to sit down and do that analysis. What did I spend last year? How will I be better off? The example I picked up was a patient that had a $290 per day copayment, and that copayment was due for the first 7 days of the admission. So that's what, $2,030 if the patient stayed 7 days. Now that plan also had a maximum out of pocket for the year of $5,100. So if you were in and out of the hospital, had a lot of different expenses, the maximum out of pocket cost for your Part A and B services would be $5,100. I really couldn't list all the Part B outpatient services because they vary depending on what the service was. The co-payments would vary, but now you should still have the same premium as original Part B. I am seeing something on the news or the TVs. I always say this when I'm watching the news. The commercials, I think, target people when they're watching the news. It talks about how they have a Medicare Part B premium buy down. I'm not sure how that works. That's something new. But typically, you're going to owe the Part B premium each month. They're going to take out your Social Security check regardless. But now your co-payments for outpatient services would be different depending on if you're there for outpatient surgery, an ER visit, your physician's office, and it might even be different for a specialist visit. So again, those are the things you're going to write down, and that old thing of write a list of pros and cons. What are your costs now? What would your costs be under the new plan? All right, so coverage. Original Medicare covers services in hospitals, physicians' office, other facilities like the skilled nursing facilities, anything that's covered under Parts A and B. A Medicare Advantage plan must cover all services that original Medicare covers. Now, sometimes they offer different benefits as a perk, like vision or dental, or let's see, I think one of them that the PHIP members have is if they put an app on their phone and they get so many steps in per month, they get a little gift card. So there are different little perks. One thing I always caution anyone about is that situation of when you might accidentally need a skilled nursing stay. Like we said, a joint replacement might require you to go have some inpatient rehab. Be sure you understand how that Medicare Advantage plan looks at those stays and that they're covered equally. Questions so far? Okay. Now we talked about other coverage. If you have Medicaid, your decision's not so hard because if you have Medicaid secondary, you're considered to be dual eligible. You shouldn't have any out-of-pocket expenses. And in some cases, your Part B premium is actually paid for you. Now, you can purchase supplemental insurance. And I think the common one everybody has heard of is C+, but there's others out there like AARP, Mutual of Omaha. There's a long list of them. And they pick up and pay the portion that traditional Medicare does not pay, like your deductibles and your coinsurance. Now, some people that have benefits like TRICARE for Life, if you're retired military, you have a perfect secondary, and you don't have to worry about what's going to pay those additional balances. You already have something in place. And I'll use my parents, for example. My dad retired from Drummond's Coal. He had a Cadillac insurance plan that picked up and paid everything but $100 for a calendar year. And that insurance even covered my mom up to 17 years later until she passed away. He passed away 17 years before her, but she still carried that insurance. So that's not as common that people have that type of retirement benefit anymore. But if you're one of those fortunate enough to have that, take that into account because, again, money you would not need to spend to purchase additional insurance. Yes, ma'am.
Does that automatically work? Like my ex-husband was in the military. Does it automatically work that I would get that?
Did he retire? Was he a retiree from the military?
He retired as a full bird colonel.
Oh, then yes, ma'am. I would think so. Now, some of it might depend on you said ex-husband, correct?
He's dead.
Oh, your deceased husband. Okay, yes, you should have that, but yes, you can check into that. I will see if we can get you some resources.
Okay, thank you.
Because TRICARE for Life picks up and pays that Medicare deductible when you get admitted to the hospital, and you wouldn't need to pick up the supplemental care coverage. And one thing to keep in mind is the Medigap plan, which is what we call that up there, the C pluses of the world and such. You can get those as well if you choose a Medicare Advantage plan, but I would look at the evidence of coverage on that Medicare Advantage plan just to see that it's going to work with that secondary insurance, because you don't want to spend money on something that's not going to help you. Prescription drugs, like we said, original Medicare does not pay for prescriptions you take home that you pick up from the pharmacy, and I know that can get very expensive. Some of the Medicare Advantage plans do include that in their coverage, but again, look very closely. Not all do, and it may depend on if you're picking out the gold plan, the bronze plan, or the silver plan. Which plan you pick will determine if you have drug coverage or not. And the other thing I would say is look at that drug plan and see if the current medications you take are on that list. Because most of these drug plans have what's called a formulary. And for example, if there's a new medicine out for heart rhythm, and it's the new best medicine, but there's not a generic yet, well, the drug plan may say that there's an equivalent drug that would work as effectively. So they will expect you to use that drug versus the new improved one, unless you can get justification from your physician as to why the standard drug doesn't work for you and you have to have the more expensive one. So if you're wanting to make sure your drug costs are covered, check the list and see if your medications are covered. Okay, your choice of doctor and hospitals. If you have original Medicare, you can go anywhere you want to in the United States as long as that provider accepts Medicare. I've never encountered a hospital that doesn't accept Medicare, and most doctors do. But again, you check. So you can go where you want to go without, worrying, will I be covered or not? Now, if you have a Medicare Advantage plan, the thing you want to take into consideration is those plans have a network of approved doctors and hospitals, and that's where you have to go. Otherwise, your service won't be covered unless it's a true medical emergency that takes you to the ER. So check the list of that plan and see, will the doctors you want to see and the facilities you want to use be covered by that plan? Because if you're like me, I have my doctors I like, and I don't want to change. The other thing to take into consideration is if you have a Medicare Advantage, you may have to have authorizations to see a specialist. Referrals to see the specialist. And something you don't see is that you would need authorizations to get services. That's something that the doctors do on the back end, the hospitals. They have to get the authorization for that to be covered. Whereas with traditional Medicare, there are very few things that have to get a prior approval. Now, in 2024, we've been told that the Medicare Advantage plans will have to act more like original Medicare. We haven't seen all of that happen yet. Quality of care, how satisfied are you with your current care, either by your providers or your health plan that you're using? And if you want to get opinions from other people about either your current providers or ones you're considering, that's something else that's available on the Medicare.gov website. It'll give you a comparison of how people have rated health plans and providers of care. So you can get a little information there to help form your opinions. Oops, I went too far. And the last thing to consider is travel. Now, if you go outside the United States, Medicare is not going to cover that. If you've got that dream retirement European riverboat cruise scheduled, you might want to get some travel insurance. The same thing is true with Medicare Advantage. Typically, that's not covered either, but again, if you look at the evidence of coverage document, it will tell you how they handle overseas travel. But more importantly, I would look at local travel within the United States. If you're one of those folks that I call a snowbird and you want to go south for the winter for about 3 or 4 months and visit some family, keep in mind if you've locked in with a Medicare Advantage plan and you decide, oh, I'm down here, I'm going to go see my cousin's doctor and get my bone scan done or my mammogram done. It's just this time to get it done. I'm going to get it done. Well, that probably won't be covered because you have a selected network of providers you're supposed to see in your area. Now, if it was an emergency room visit, yes, that would be covered. So when you're traveling, keep that in mind, that if you're locked in with an Advantage, you would need to do elective things when you're at home, and only emergency services would be covered. Yes, ma'am?
Yeah, if you're traveling and there's a need to be airlifted to another medical center, how is that covered?
It can be. It's a little bit complicated, but yes, yeah, it is covered. And air transport is under your Part B benefit, just like your base ambulance would be. All right, I've probably made your head hurt, giving you reasons to scratch your head, so what kind of questions do you have?
I have a question. Are there services available for seniors that really don't know what to do or how to pick if they don't have family members, especially the elderly that know how to read this or pick or what? Is there anything out there, any agencies that they can call?
It's overwhelming. There is an 800 number on that sheet that we had some handouts over there. They can
page it so everybody can hear what her question was.
Oh, sure. She was asking, are there any services out there to assist people in making these decisions? And there is an 800 number that's on the document we have up front that you can call. And there are some, I would say, neutral parties that they can refer you to help make that decision, because it is a lot to consider. It really is. I mean, my parents didn't have to worry. They had their daughter take care of it. But I know not everyone has someone in the family that's accustomed to all this, and all the lingo gets overwhelming because they spell out the word once and then it's an acronym from their own. So it gets to be a lot. But yes, I would encourage you to call that 800 number. If you're someone that likes to go online, there's a lot of information online at the Medicare.gov website that's listed on that as well.
Okay, I have some members in my church, elderly, children that aren't around here, not living here, but it can get complicated.
Yes,
them making a choice.
It does.
Can you talk a little bit about the open enrollment time, because we're entering that time.
Yes.
There's going to be time to make that decision.
I did omit that. It starts October 15th, so it's just right around the corner. It goes through December 7th, and any changes you make will be effective December 1st. Now, if you are currently in a Medicare Advantage plan, there's a second open enrollment plan period that starts in January. So right now, the folks that are on traditional Medicare, look at it like a swap and drop period right now. You can do that now, or if you're already on a Medicare Advantage, there's another enrollment period where you can make choices and changes come January 1. Yes, ma'am.
Do you need to be on Social Security
Do you need to be on Social Security? So with Medicare, you are entitled based on 3 things. First, being age 65 or older. Second, if you're on disability, you've gone through the whole process, you've been deemed medically disabled, you can become eligible for Medicare. Or if you're an end-stage renal disease patient, you become eligible for Medicare. Now, the minute you sign up for Social Security, you're automatically enrolled in Part A, and there's no premium. But now you have to take the step to enroll in Part B. More questions?
Yeah, I have one.
Yes, sir.
We got, she's a little older than me, but.
We're not supposed to say that in public.
It's not, it's
I'm proud.
just a couple of years.
I'm proud.
So, we got into Social Security when I turned 65. And she was covered under my insurance because I worked till I was 65. And then they come back and said, well, there's a penalty because you can't prove that she had insurance for last year. Which she did. We went for 2 or 3 months fighting back and forth, said, look, she had it. Well, you got to prove it or else we're going to fine you for that whole year for her not having insurance. So that's something to look into before you check into it.
Yes, if you can show credible coverage that you had it and you chose not to elect it until you retired,
Right.
Although she was already of age, they should waive that penalty.
Yeah, we had a heck of a time.
You got it done, but you had a headache. Mm-hmm.
But it was.
Other questions? Yes, ma'am.
I don't have a question, but I recommend there's a senior services in Pasadena. They can take your list of prescriptions, enter them into a computer, and tell you which insurance plan is most cost effective.
Could y'all hear that in the back?
No.
Okay, there's a senior service in Talladega that will take all your prescriptions and they will enter it into a system and help you find a drug plan that's the most effective for what medications you're on.
They used to do it in so complicated. I have to go there. I don't think they do.
I've not heard of that one. All right, y'all, I'm a foreigner. I don't live in the area. I live in St. Clair County in a place called Moody, and I promise it's a place, not just a state of mind, so I don't know all the local places in here.